So, welcome and thank you. As I said earlier, my name is Des Byrne. I'm responsible for customer support at XAbility. Today, I'll be talking about CVS and specifically about its digital strategy. I picked CVS for this particular webinar because a lot of their digital strategy materials use the term personalized, and I found this interesting. CVS used this term in the context of a customer experience. It's not used in the same way as compounders use personalized for personalized medicine. But nonetheless, CVS has started to deliver a personalized experience via digital tools. And it's because of this investment that I've decided to pull this webinar together. So what is CVS doing and how can you compete? This is a quote from Brian Tilzer. Brian Tilzer started with CVS 3 years ago. He's their Chief Digital Officer at CVS Health. He states that our goal is to create a personalized path to better health by creating a connected health experience that makes it radically easier for people to save time and money and stay healthy. To achieve this connected health experience, CVS has 3 investment priorities to deliver on their integrated pharmacy and healthcare delivery model: an integrated storefront experience, an integrated pharmacy experience, and integrated health tools and services. CVS cites the investment in their curbside initiative. As an example, what curbside does, it enables patients to pick up a script that's ordered via their CVS mobile app at the curbside of a CVS store. It is grounded in the belief that consumers want more convenience in their life or want ultimately to save time. Success for CVS. Business success for CVS means solving real customer problems. Plus, a better customer experience for CVS has always meant stronger success-related numbers and metrics across all of CVS touchpoints. That is including in-store retail, pharmacy, and on digital channels such as web, mobile app, email, SMS, text, etc. So what is the CVS approach to improving the customer experience? They focus on how to enable healthier lifestyles, save the customer money, and save the customer time. And ultimately, when it comes to technology investment, if cool technologies and concepts don't solve one of these 3 core challenges above, so enable healthier lifestyles, save the customer money, or save the customer time, then CVS won't invest resources into it. Which brings me to Beth. Beth is a core customer of CVS. Beth has 2 kids and a husband. She and her husband work full-time, and Beth is the Chief Health Officer of the household. Beth has a son who has a cold, and her daughter has a chronic disease similar to Crohn's. Her husband has diabetes. But who is Beth, and why does it actually matter? Well, in this instance, Beth is a buyer persona. She is a fictional representation of one of CVS's ideal customer. And she represents a significant portion of CVS's script revenue. This matters because if you don't know what your ideal customer buys, how they make purchase decisions, or what they need to fill the gaps in their lives, you can't effectively reach the people that are most likely to become your most loyal and dedicated customers. And this is particularly relevant in the context of marketing your business via digital channels, where you don't always have personalized and personal one-on-one interaction. So, buyer personas are fictional representation of your ideal customers. They are based on real data about customer demographics and online behavior, along with educated speculation about their personal histories, motivations, and concerns. A persona includes demographic profiles and can include the following types of information: age, gender, employment status, marital status, income level. And whilst demographics might provide some insight into your customer, a buyer persona takes it to another level. It brings it a step further. A buyer persona will include additional information such as daily activities, frequent challenges, frequent pain points, why certain purchase decisions are made, what makes a person decide between your business and a competitor, how purchases are made, the questions they frequently ask when purchasing, and what might make their life easier. Buyer personas enable you to organize your audience segments and make your marketing stronger. What type of marketing content should you consider producing? Which media outlets should you target? What elements to include or exclude from your sales process? And finally, what products or services you should develop. And it is this last item in which CVS has excelled in its digital transformation. It has created multiple buyer persona, just like Beth, to drive their digital transformation. So let's get back to Beth. Beth relies on push notifications via the CVS app to alert her when her family's prescriptions are ready, therefore avoiding unnecessary trips or phone calls. She relies on an online portal to add, remove, or modify existing scripts, and maybe even review prices and look for generic brands in the CVS context. She relies on scheduled prescription delivery for recurring needs. She relies on the automatic extra care rewards, which is linked to purchases and mobile in-store experiences. Beth also relies on message alerts for items such as flu vaccinations, and on the easy minute clinic appointment set up for her son, for his appointments, and health follow-ups, again, like flu vaccinations. So Beth relies, and this buyer persona relies on these 6 elements. And these 6 items are the thing that CVS has targeted at people like Beth in their digital tools. But Beth is one of many buyer personas that CVS has created. And CVS has created other technologies for other personas. For example, they have CVS Express or Curbside. Orders are done in-app and picked up at the curb of a CVS store. This has currently been trialed in California and Georgia and will be rolled out nationwide during 2017, with the exception of some downtown locations. It will be a free service, and circa 75% of script medications will be available as CVS Express. And for example, we already have a PCCA member who has built a drive-through and services his customers using his mobile app. They also implement digital receipt programs for other personas. Users can have receipts emailed or sent directly to the mobile app, eliminating paperwork. They have mobile prescription pickup, allowing users to pick up the prescriptions by scanning a barcode at the pharmacy. This reduces the interaction with the patient at the pharmacy and reduces anxiety in front of other patients. Other personas may rely on holding my place online. This allows customers to get in line ahead of time and view wait times at the local CVS Minute Clinic from their smartphone. Scan a paper script, start the prescription fill process by capturing a photo of a written prescription through the CVS mobile app. This is important because it is estimated a third of prescriptions are never actually filled. This tool enables customers to quickly and conveniently start the prescription fill process by capturing a photo through the app. And the last one they focused on is insurance card scan. Consumers can easily share new insurance information with CVS by taking a photo of their insurance card with their CVS app, instantly updating data across the store network. So is this working for them in CVS? And in short, yes, it is. More than 50% of digital prescriptions refills are from mobile devices. That was last year in 2016. The CVS Health mobile app has been downloaded nearly 12 million times by 12 million people. And CVS sent 300 million reminder messages in 2015. And I think this has to be viewed in the context, and they talk about this quite openly, about them trying to grow their business. $1,000 billion or $1 trillion are spent per annum on chronic diseases nationally. Over 110 million scripts are abandoned per annum nationally. And $290 billion in preventable medical costs occur because people are not adhering to their script medications. And the number one reason for non-adherence is simply forgetting. And this isn't just specific to CVS. Something I didn't realize is that pharmacy products account for nearly 10% of Walmart revenue, and is a focus of growth, primarily because healthcare spending will increase 6% through 2024. Walmart believes that pharmacy, and specifically investments in pharmacy technology, will increase their revenue per square foot by 1% per annum. Walmart upgraded its pharmacy app earlier this year in March of 2017. And the upgraded app allows customers to fill prescriptions via the app before they visit the store. The company is also setting up express lanes in its stores where these customers can pick up their scripts. Walmart estimates that the upgrade and the express lanes will reduce the wait times for pharmacy customers to under a minute from the current 6 to 11 minutes. This upgrade could also ensure that customers use Walmart's mobile app more frequently. Walmart has executed on this strategy as it believes that some customers value convenience as much as they do price savings. A focus on convenience to reduce wait times could draw more customers to Walmart's pharmacies. And that's from an investment report. And sort of to think of these things as just as a mobile app is sort of to misrepresent the transformation that is really occurring within our industry. Investment in technology, and specifically their mobile app, has enabled CVS to reposition itself from a drugstore chain to a provider of innovative health services. They've even changed their name from CVS to CVS Health. And CVS uses the term personalized because CVS deliver personalized services, content and material via digital tools and specifically via their mobile app. And the other thing that I have observed is that digital experiences are deeply integrated into business operations. For example, CVS Curbside or CVS Express or the Walmart Express lanes. So the technology has become deeply embedded in the business operations of the pharmacy. Which brings me to RX Mobility. RX Mobility technology enables independent community pharmacies to compete with chains like CVS. It is a Fortune 500 mobile technology platform purpose-built for independent community pharmacies and optimized for compounding. And the reason it does not cost tens or even hundreds of thousands of dollars is that lots of PCCA members are using the platform. RX Mobility is really easy to use and works seamlessly with PK Compounder RX to engage patients, save time, and increase refill revenue. So what exactly does it comprise? Well, firstly is an integration with PK Compounder. The tool, RX Mobility, integrates very tightly and automatically with PK Compounder. That's the first thing. The second thing is a pharmacy portal that the analogy I use for the pharmacy portal is like a telephone. It's a way of communicating with patients who have your app. And the last item is the app. And the app is what the patient experiences, and that is what the patient has on their cell phone, and it's the window into your compounding pharmacy. RX Ability is a refill patient engagement marketing tool for compounding pharmacies. It is provided exclusively to PCCA members. And RX Mobility integrates with your PK dispensing software. RX Mobility automatically takes refill and other pertinent information from PK software. It uses that information to remind patients to fill a script or to refill a script, to report on refill compliance, and to communicate to the patient when a script has been dispensed. It does all of this automatically without any intervention by the pharmacist. It's an automatic workflow. It saves a ton of time on telephone calls and in the workflow in your business. Just a little bit about what the app is. It's pharmacy branded, and it's available for free for your patient to download from the Apple App Store and for Google Play for Android smartphones. It includes information such as services, contact directions, refill reminders, order my refill, order scripts, and dose reminders. It also includes personal script messaging, enabling you to actually send messages to a patient about their script, and it also has a marketing module enabling you to blast message, marketing and educational content to your patients, to any patient who has downloaded the app. The app can handle multiple patients. It's fully integrated with PK Compounder, and it is HIPAA compliant. A really good example of a sample workflow is, and let's just concentrate on refills. And it's one of the key items that CVS concentrated on in its app. Patient has downloaded the app, it's on their cell phone. They open the app, they put in a script number that's generated by your PK compounder RX. They put in their date of birth to verify who they are. And we've got various messages between XAbility and PK software that will be sent to the patient based on the status of the script, the status of their date of birth, and the actual the refill itself. Assuming everything's okay, the script lands directly into your to-do list. And as a compounder, then you work on your to-do list and you work at filling the script. So you may have a 24, 48-hour production cycle time. Automatically then, once you come to the point of dispensing the script, a message gets sent to the patient telling them the item has been dispensed. It comes in as a push message alert in exactly the same way as you would have a Facebook or a news app telling you that something new has come in to your cell phone. So it opens up the push message center, it opens up the actual app itself, and it opens up the relevant script. And that whole workflow is really seamless and it happens automatically with PK Compounder. And the really neat thing, though, is let's say your patient is on a 30-day refill cycle. Then after 30 days, minus your cycle time, your delivery and production cycle time, then a refill reminder gets sent to the patient again to remind them that a script needs to be refilled. Again, the whole cycle starts again. It lands in your to-do list and you produce the script, and then a push message gets sent to the patient when it's been dispensed. If the patient ignores that refill reminder, we actually give you tools within the portal, the pharmacy portal, to actually see who's ignored the refill reminder, and we give you the tools to actually go and act on it so you can escalate it further if you so desire. So that's a really good example of a particular workflow. The pharmacy portal is an additional tool that we have for you. It includes things like marketing messages. It has a refill reminder report embedded into it, which is a brand new feature. It has secure script messages. It enables you to receive new scripts. It enables you to have website refills because you can have a website refill form on your website. And it also gives you an overview of weekly adherence reports. So what can you expect? Well, approximately what we've seen with Midsize Compounders is about 1,000 downloads. And once those downloads are on a patient's app, you can message them directly using the marketing module. So you've got 1,000 downloads. What we're seeing is about 10% of script volume coming from XAbility. People who've implemented the program have seen a refill revenue increase of about 3% from XAbility users. And they've done this because they've been able to reduce the actual the time between refills slightly. And one of the big savings is on reduced phone time. Anecdotally, we're hearing from members that there's a reduction of about 8 minutes phone time per patient per month, although I suspect talking to others, it's significantly more than that. So 8-minute reduction in phone time per patient per month, multiply that, say, by 100 patients using the app or 500 patients using the app, and you get a sense of the amount of time saving that you can have by using the app. So that's sort of a quick overview of what CVS have been doing in their digital business, how they have gone to market with their mobile strategy, how a buyer persona has been created, and multiple buyer persona has been created to transform CVS as a business and transform them into a real a digital hub for activity. The buyer persona itself is really important. If you haven't come across it, there's a sort of a format to use for buyer persona, and it's really worth looking at. My guess is that each compounder will have about 4 or 5 buyer personas that are really worth looking at. And, you know, these things may not have been that important prior to digital tools, but as you get further into digital tools, it becomes really important to segment out your buyer persona. So who is your Beth? You know, is Beth, is she a lady age 50 with 2 teenage kids, a dog and a husband? And, you know, you can very quickly, from those 3 criteria, you could say, right, Beth would be a target for one type of medication, let's say BHRT, her husband possibly for others, her kids maybe for others, and her pet for other medications that you would service. And you can see how by having that buyer persona, you can facilitate cross-selling between the cross-selling within a single family unit, for example. And so you'll find that there are other buyer personas that you would have for your business, and there's ways of actually doing this buyer persona. And we might assemble some tools and do that in another webinar, actually how to create one. So I think it would make sense. So that's an overview of how CVS have really repositioned themselves, how they have used the buyer persona to create a digital strategy, and what the success of that strategy has been. And ultimately, we have been attempting to actually replicate elements of that strategy that make sense for compounding pharmacies, and that's what XAbility is about, and that's why it's integrated so tightly with PK Compounder, and it helps with your workflow in the actual lab itself. So I'll turn it over to you folks. If you have any questions, just please type them in, and please let me know, and I'll answer your questions as best I can. So I've a question here about getting the app downloaded. So yeah, we actually provide a series of marketing materials for your business and a 3-phase marketing plan. The marketing plan in 3 phases starts off with just having getting a handful of patients to download the app, making sure it works, the workflow works, everybody's aware of what happens in the pharmacy, and your process is working smoothly. The second part of that plan incorporates more sort of in-store promotion, and we give you materials for that. They're branded in your business brand. And then the last piece of it is digital, and the digital plan has increasingly been overlapping with increasing your marketing visibility of your business online using digital tools. But we give you that 3-step plan, and we give you the tools, the actual marketing materials to actually support that plan. So various things like PDFs, documents, videos, and other items. So thank you for that. So what is the cost of implementing XAbility? Question has come in. So yeah, it's it's $249 a month, and that's unlimited patients, unlimited downloads, unlimited pharmacists, unlimited push messages for $249 a month. It's invoiced through PCCA. It's supported by PCCA. There is one single upfront charge related to PK. PK requires an upgrade. It's a $1,000 upgrade. And once you go to that version of PK software, then we can integrate the app into the PK software. And that's the price. So question on training. So yes, we have training materials. So we have actually about 16 videos that we've done for trainings. We cover everything from the mobile app itself and how it works, the pharmacy portal, how it works, the integration with PK, the detailed integration with PK, information like that is in the app. Any other questions from anybody? So yeah, a question on dispense. So dispensing a message. So what happens is at the completion station, PK sends XAbility a dispensed message. The patient is then sent a push message alert confirming that the medication is ready. And this alert contains information on the selected delivery mechanism. And yeah, so it would work with all PK workflows, including RxWatch and location tracker. So any workflow that you have, it will actually work with it. Okay. So what happens if there's an issue with the script? So if there's an issue with the script, the patient is sent a message outlining the issue. That particular message is driven by PK. So let's say the date of birth is invalid, then the patient gets that. If a script has expired, then the patient gets a message to call the pharmacy. If the refill remaining equals 0, then the patient receives an alert that the pharmacy will call the doctor and will contact the patient if needed. So there are a series of messages built around that. So the question here on scripts, how are they flagged, or how do you know that they come from XAbility? So there are any scripts coming in from the app, and any will actually be flagged with XAbility, and they arrive into your to-do list. Again, they're flagged with XAbility, plus there are a variety of different reports that can be run. So you can see scripts that have come in from XAbility. There's 3 or 4 different reports that you can run to manage the business on a daily basis. Okay. Those reports, actually just looking at it, refill reminder, log of scripts, and data mining reports in PK. So I have a question on the refill reminders. So yes, the refill reminders are sent automatically to patients based on data in the day's script at standing field. So that's a field that's actually in PK itself. Okay. Any other questions? If you want any other questions, just let me know, and I will do my best to answer them. If anybody wants a demo, just let me know, and we can do that for you. So that's it then. Any other questions? Do you record this? Yeah, we will have a recording of this presentation. I will put up a full recording on our website in about 2 days. I also tend to do an abridged version of it, which would be about somewhere between 5 and 7 minutes, and that will also be on our YouTube channel and on our website. And I'll send everybody who's attended this a link to that recording. And any other questions from anybody? Okay, if that's it then, thank you very much. I hope you have a couple of ideas about what CVS is now doing, and some thoughts on how to compete with them. In summary, the persona is important, the buyer persona, and getting that right is important. So who are your buyer personas? And then increasingly, what I'm seeing, if you're going to go down digital strategy and you're going to specifically implement a mobile app, the best executions, best implementations are when it's strongly tied into your pharmacy's business and business operations. And increasingly, we're starting to see that with the likes of CVS and Walmart with their express lanes and other benefits that they give users of their mobile app. So thank you very much. Much appreciated, everybody, and talk soon. Thank you. Bye-bye.